Today we will talk about health tech and aging population. Discuss the role of health technology in meeting the medical needs, care support, and social interaction of the aging population. Growing life expectancy poses important societal challenges, placing an increasing burden on ever more strained health systems. Digital technologies offer tremendous potential for shifting from traditional medical routines to remote medicine and transforming our ability to manage health and independence in aging populations. In this perspective, we summarize the current progress toward, and challenges and future opportunities of, harnessing digital technologies for effective geriatric care. Special attention is given to the role of wearables in assisting older adults to monitor their health and maintain independence at home. Challenges to the widespread future use of digital technologies in this population will be discussed, along with a vision for how such technologies will shape the future of healthy aging. The world's older population continues to grow remarkably fast, with humans aged 65 years or above projected to rise from 10% in 2022 to 16% in 2050, ref. Such rapidly increasing life expectancy presents major health challenges and is expected to impose substantial socioeconomic burdens. As people live longer, they are more prone to having non-communicable diseases, for example, diabetes, kidney failure, arthritis and Alzheimer's or Parkinson's disease, which require continuous monitoring and management. Older adults experience a progressive decline in their physical and cognitive skills and are likely to experience several pathological conditions simultaneously as well as critical events such as falls or strokes, fig. The increasing geriatric population, coupled with the decreasing caregiver workforce, puts substantial pressure on healthcare systems globally regarding operational costs and resources. A primary societal goal is to support healthy aging while maintaining older adults' autonomy and safety at home. Traditional health assessments relying on in-clinic visits, face-to-face contact with the doctor and nurse and annual laboratory testing are inconvenient and costly and suffer from delayed analytical results and potentially late diagnosis. Accordingly, such a traditional approach cannot offer a continuous and longitudinal assessment of the patient and is limited to applications for which infrequent tests are sufficient. Hence, it does not meet the rapidly growing healthcare demands of the fast-growing aging population. The application of digital technologies to assist clinical practice can address these increasing demands by offering convenient, continuous remote medical care to older patients and holds considerable promise to transform geriatric care. In particular, wearable digital technologies are expected to provide healthcare professionals with continuous access to the health status of older adults and offer unique opportunities for effective remote care. Wearables can support older adults in remotely tracking chronic health conditions or ongoing treatments and monitoring for safety concerns and can do so without disrupting daily activities. For example, wearable platforms can continuously and non-invasively capture biometric and biomolecular data, which is not feasible by traditional health assessment. They can generate instantaneous alarms in cases of emergencies, such as stroke, seizure or fall, to allow timely medical interventions. Such tools are also expected to reduce geographical inequalities by providing older adults living in rural areas with improved access to healthcare services. The demand for providing healthcare at a distance, that is, telemedicine or telehealth, has increased sharply during the COVID-19 pandemic. While intermittent in-clinic visits will remain an essential part of healthcare services, we anticipate an increasing involvement of wearable devices in this process. In this perspective, we describe the main types of wearable and non-wearable technologies that hold promise for healthy aging and geriatric care. We discuss the challenges of translating this technology into broad clinical use, and we outline our view for a future in which such technologies are embedded in the healthcare landscape. Technologies for healthy aging. Wearable sensors, capable of real-time on-body monitoring of various aspects of the wearer's health or behavior, have garnered enormous attention over the past couple of decades owing to their diverse applications. Fig. Wearable sensors have evolved rapidly since the emergence of the Internet of Things and mobile devices, from early trackers of the user's mobility and vital signs to current advanced, multimodal sensing devices, capable of generating valuable molecular data that were impossible to obtain a few years ago. 6. Current and emerging digital monitoring devices can be broadly grouped into 4 categories: wearable physical sensors, wearable chemical sensors, hybrid and multi-parameter wearable sensing platforms and non-wearable sensors. Wearable physical sensors. Most commercial wearable devices rely on physical sensors that measure physical signals of the human body continuously and longitudinally over prolonged periods. These include continuous measurements of basic vital signs, heart rate, electrocardiogram, ECG, respiration rate, body temperature, oxygen saturation or blood pressure. Physical wearable sensors also monitor mobility and other activity-related signals, including steps, using miniaturized motion sensors, such as accelerometers or gyroscopes. Such wearable devices can detect fall events or assess the gait disorders of patients with Parkinson's disease. For example, an ongoing, randomized trial involving 200 older adults will evaluate the effectiveness of an Apple Watch in detecting falls. Continuous and remote monitoring of vital signs can trigger warnings of adverse events and deteriorating conditions in older adults, including the early onset of cardiovascular, neurological and pulmonary diseases. For example, abnormal respiration rates can predict respiratory failure, elevated body temperature can indicate an infection, and abnormal ECG patterns can alert for cardiac arrest. Indeed, physical wearable sensing devices have long been used to monitor cardiovascular diseases since the initial recording of cardiac heart rate and ECG signals in the 1960s. Modern epidermal physical sensors can now enable remote monitoring of older adults in their homes for a wide range of key vital signs, performing virtually much of the traditional office-based physical examination. For example, such real-time sensing devices have been useful for detecting abnormal physiological events, such as the onset of COVID-19, ref. What do you think of our video? Let me know in the comments section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.